Hello, I'm Liz Bishop, Chief Executive of the Clatterbridge Cancer Centre. I'm going to talk you through our performance last year. I'll also give you an overview of our plans looking ahead next year and our 5-year strategy which we developed last year. It goes without saying that the year was a challenging year because of the pandemic, and I'd like to take this opportunity to thank our staff and volunteers for ensuring that our services continued in a safe way and for all of the efforts that they made. I'd also like to pass on my sincere condolences for all those affected by the pandemic. Personally or professionally, it's been a very challenging year for everyone. However, although we had our challenges, last year was a very significant year for us because we opened our new state-of-the-art hospital last June in the midst of the pandemic, and we're very proud of that. So looking back in the year in terms of our activity, well, as I said, we continued providing cancer care right throughout the pandemic, with some changes in the way that we work to keep patients safe. You can see the number of treatments on the slide, but basically we saw almost 32,000 patients last year. 13,000 of those patients were new patients, and that was 2,000 more than the previous year. So you can see we've been busier than ever. We did change the way that we delivered some of those treatments in line with national clinical guidance to keep patients safe. And one of those changes, for example, were to breast cancer patients, where we've managed to condense the treatment, still just as effective, into 5 visits for radiotherapy instead of 15. And again, that was to keep patients safe. Key highlights from last year, well, despite the significant challenges presented by COVID, there was a lot of positive things that happened. Of course, the opening of the hospital was the main event last year. I'm also pleased to say that our cancer performance in terms of our waiting times targets, we delivered those, and they were extremely good. We were also shortlisted for several national awards, and we've continued to perform well on our national NHS survey alongside our inpatient survey. And I'd also like to mention and thank our patient engagement and inclusion group, which is led by one of our governors and has other governor representation on it. In terms of our COVID response, well, we'll forever remain scarred by COVID, but in some respects we've continued to become stronger and better and take those learnings from the experience to make sure that our services continue to be responsive and safe. We immediately put our emergency plans into action with a clear command and control structure and processes for clear decision making. So for example, we ramped up our home delivery service using volunteers that we recruited very quickly. We introduced MS Teams so our teams could continue to be as effective. We rolled out phone and video consultations so patients could access specialist care from their own homes, and we expanded our treatment at home and treatment at work service. In terms of going back to the celebration around the opening of the new Liverpool site, well, it was really motivating to transfer those patients from the Wirral to the new site last June, and that went very smoothly. His Royal Highness the Prince of Wales gave a very personal video message to our staff, which was wonderful to see as well. The opening on time during a pandemic was a huge achievement. I want to pay tribute and thanks to all those involved, including our staff, our partner organisations, construction teams at Lang O'Rourke, and our suppliers, and of course the 90 volunteers that helped make it all happen. It was a huge team effort, and I'm very grateful to all of those involved. It truly is a spectacular hospital across 11 stories, 110 single rooms, all en suite, state-of-the-art facilities and kit and technology to truly transform cancer care and treatment across Cheshire and Merseyside, and it's been very welcomed by patients. We've had a lot of positive feedback about the patient environment there. Of course, we continue to provide all of those services, including radiotherapy, diagnostics, chemotherapy, psychological support, to name but a few, and of course the advice and guidance and support of all our staff. And having this new centre sandwiched between the acute hospital and the Royal Liverpool Site, and of course the university on the other side, means that not only we can provide support for acute patient pathways, but also expand our research portfolio, which brings me nicely onto our research. So last year, like all health providers, our research was impacted on by COVID, but we quickly introduced new studies on COVID and cancer with funding from our own charity, including a large study on COVID in people with cancer and a research study on our staff's health and well-being. We were recognised for that work by the NIHR for our dedication and commitment during that period, and although we, as I mentioned, we were impacted by COVID, we were able to unpause the studies that we had paused very quickly, and we're performing above a national target on our research. And we also significantly increased the number of our own clinician-led studies that we sponsor. One of the areas that we've developed further in is first-in-human cancer vaccine studies led by Professor Christian Ottensmeyer in head and neck cancer, and it's that kind of research that wouldn't have been possible had we not opened our new site in Liverpool. Going forward, we continue to support and foster a research culture across the Trust. We introduced fortnightly research rounds, for example, which is well attended by staff and university colleagues presenting their work. It's hugely motivating for each other to hear what everyone's doing, and fascinating meetings to attend. And in the last year, our radiology and research teams have also set up our first ever interventional radiology service, so again, very grateful to them. Our digital developments, well, the digital team have worked enormously hard during the pandemic to ensure all of those adjustments were rolled out very quickly. There are sort of hidden heroes, if you like, and we wouldn't have been able to respond to the technology demands unless we had an extremely effective digital team. For example, in May last year, we ranked second in England for NHS Microsoft Teams activity. We're quite a small trust, so that was that shows you the scale of activity that was going on in our organisation. We also rolled out Attend Anywhere, which enabled the video consultation, and other measures put in place, which are too long for the purposes of this presentation. But the digital developments have been enormous over the last year. In terms of quality and performance, well, as I said, we delivered the cancer waiting times targets. We strengthened our internal performance review processes. And in terms of quality indicators, I'll just mention a few. Our length of stay was above target. Our new hospital treated more complex patients. We were able to provide mutual aid for other providers nearby, and we've done well on our management of infection. Our Clostridium difficile, we had 5 cases against a target of 4, and of course we're looking into that, and it's probably related to our more complex cancer patient portfolio. It's similar to what is seen in other cancer treatment centres. We've had no never events, and we reported 8 serious incidents, and of course they were investigated thoroughly. In terms of our new 5-year strategy, well, the new hospital in Liverpool was the culmination of the last 5-year strategy. So quite rightly, we developed our next 5-year plan. You can see that in the 6 themes on the slide there. And all of that will coalesce together to make sure that we strive to deliver our mission to drive improved outcomes and experience for patients in our region. and it means working with others. It means being a great place to attract and retain our staff. It means strengthening our research portfolio, underpinned by excellent digital capability, and of course to be an outstanding organisation. I'd just like to mention the Cancer Charity, who were also impacted on COVID, but I have to say they've managed to maintain their energy and enthusiasm, managing and hosting such events as the drive-in movies, which brought a bit of light entertainment for our donors and supporters and staff. It did achieve its fundraising goal of more than 2 million despite the challenges of COVID, and the charity continues to support our work, funding vital research, and also setting up an innovation fund. So they're our secret weapon to make sure that we can continue to go above and beyond in everything that we try and do. With regards to our wholly owned subsidiaries, well, PropCare obviously did a fantastic job in delivering the new hospital. They're our property and estate subsidiary. Huge thanks to them, and we couldn't have achieved that without PropCare. Pharmacy is our outpatient pharmacy dispensary, and of course they were key in mobilising the pharmacy delivery service with the volunteers that I mentioned earlier in the presentation. The Cheshire Merseyside Cancer Alliance is the vehicle that we work through to work closely with our partner organisations in terms of cancer diagnostic, screening, surgery, and other bits of the cancer pathway. That has been key during the COVID pandemic, enabling us to double our endoscopy capacity, setting up a diagnostic and surgical hubs to get the best use of the capacity across the region. We also rolled out fit testing to ensure that we could minimise the waits for endoscopy during that time. We also had a key focus on rapid diagnostic services, including targeted lung health checks, which is a rapid pathway to diagnose lung cancer straight to the right test. So again, very grateful to the Alliance team who've worked enormously hard during the last year. So our focus in the here and now and going forward is obviously to deliver our strategic plan, working on genetic and genomic medicine, interventional radiology and more diagnostics. We're also working on estates master planning for the Liverpool Site in partnership with Liverpool University Hospital. And we're working together with other partners, to become a new statutory organisation, an integrated care system across, in line with what's happening across the NHS in England, and that will be in place by April 2022. We'll continue to work on our quality and operational targets, deliver our subsidiary companies' plans, and of course continue with the COVID booster programme and COVID recovery. So on a final note, we're also re-establishing the functionality of our aseptic production unit on our Liverpool site, and that's a key activity that's going on currently. So finally, I'd just like to say a huge thank you again. Thank you for listening and watching our annual members meeting. Thank you for your continued support of the Clatterbridge Cancer Centre. It's fair to say it's been a year like no other, but hopefully we've been able to demonstrate to you that we've remained focused, remained determined to do what we need to do for our patients and staff, and we look forward to the coming year. Thank you again.